Do you constantly feel mucus stuck in your throat? Clearing your throat all day? Cough worse at night? What if I told you the real cause might not be allergy and not even too much acid? Most people think chronic throat mucus means sinus infection or allergy. Doctors often prescribe antacids. But what if the real problem is actually low stomach acid? Stay with me. This may completely change how you look at acid reflux. If this sounds familiar, you need to watch this carefully. Today we are going to talk about chronic phlegm in the back of your throat. Instead of thinking like a medical label, let's think like an engineer. An engineer asks, what is the cause? What is the effect? What is the root mechanism? Because mucus is not a disease, it's a response. Common symptoms you might have. If you have chronic throat mucus, you may also notice post-nasal drip, chronic cough, hoarseness, scratchy throat, lump sensation in throat, sore throat without infection. Sound familiar? Now let us go deeper. The hidden connection, acid reflux. Two major conditions are often connected with chronic throat mucus. Number one is GERD, Gastroesophageal Reflux Disease, and next LPR, Laryngopharyngeal Reflux. According to the National Institute of Diabetes and Digestive and Kidney Disease, GERD affects about 20% of the people in the United States. That's huge. What's the difference? In GERD, acid flows up into the esophagus. In LPR, acid goes even higher into the throat and vocal cords. That's why you may get hoarseness, metallic taste, chronic throat clearing, mucus buildup. Why it is worse at night? When you lie down, gravity no longer helps keep acid down. The lower esophagus sphincter may not close properly. So, acid irritates your throat while you sleep. Your body responds by producing mucus as a protective layer. The standard treatment problem. Doctors often prescribe antacids, S2 blockers, PPIs, proton pump inhibitors. PPI reduce stomach acid production. According to NIH and FDA reports, long-term PPI use has been associated with vitamin B12 deficiency, magnesium deficiency, increased risk of bone fractures, higher risk of Clostridium difficile infection, possible kidney disease risk. Now, this does not mean PPIs are bad. They are useful when necessary. But long-term use without addressing the cause, that is where problems begin. The big question, what if reflux is not caused by too much acid, but instead of too little acid? Let us explore. The low stomach acid theory. Your stomach acid, also known as hydrochloric acid, should be very strong, pH between 1 and 3. According to research published in the journals of clinical gastroenterology, low stomach acid hypochlorhydria becomes more common with age. Studies show up to 30% of people over 60 may have low stomach acid. Now here is the important part. When stomach acid is strong enough, it triggers the ileus valve to close properly. It breaks down proteins. It activates digestive enzymes. It helps absorb minerals. When acid is weak, the valve may not close tightly. Food sits longer. Gas builds up. Pressure pushes acid upward. And that's reflux. Why stomach acid is important? According to NIH and WHO reports on digestion and immunity, stomach acid helps kill harmful pathogens, prevent infections, absorb minerals like iron, calcium, magnesium, zinc, trigger bile release, activate pancreatic. Low acid may contribute to bacterial overgrowth, bloating, poor protein digestion, nutrients deficiency. Why you get mucus? When acid reaches your throat, your body produces mucus to protect tissues. The mucus is not the problem. It's a protective reaction. Diet, the major trigger. Now let's talk about food. Research from WHO and global nutrition studies shows modern diets high in refined grains, processed carbohydrates, ultra-processed food, omega-6 heavy vegetable oils can increase systemic inflammation. Inflammation weakens digestion. Large grain heavy meals may increase bloating, gas, pressure on the ileus valve. Some people improve reflux symptoms by reducing processed grains, avoiding late night eating, avoiding heavy meals before bed, intermittent fasting. Emerging metabolic research from NIH funded studies shows time restricted eating may improve digestion, reduce inflammation, improve insulin sensitivity. Giving your digestive system rest may help reduce reflux episodes. But always consult your doctor before major changes. What about vegan diet? A poorly planned vegan diet high in refined grains, soy isolates, processed meat substitutes, and sugar can worsen inflammation, but a well-planned, whole food, plant-based diet with vegetables, legumes, nuts, seeds, adequate protein can support gut health. It's not about vegan versus non-vegan. It's about food quality. What about betaine HCl? Some practitioners suggest betaine HCl to support low stomach acid. But important, if you have gastritis, ulcers, severe reflux, H. pylori infection, also known as Helicobacter pylori, do not self-medicate. According to NIH guidelines, ulcer and gastritis require medical supervision. Always speak to your healthcare provider before using acid supplements. Key takeaways: if you have chronic throat mucus, ask yourself, do I also have reflux symptoms? Is it worse at night? Am I eating late? Do I have bloating after protein meals? Am I dependent on antacid long term? Instead of suppressing symptoms, look for the root cause. So, the important medical disclaimer. The video is for educational purpose only. If you have severe symptoms, difficulty swallowing, weight loss, chest pain or bleeding, see a doctor immediately. If this video helped you understand your symptoms differently, like, subscribe, comment, acid below. And if you want a detailed breakdown of how stomach acid actually works in digestion, watch the next video on hydrochloric acid. You don't just suppress symptoms, you fix the system.